Speaking of health, just last week, Mayor Bill de Blasio released some really concerning numbers regarding a significant drop in child vaccines during this pandemic. The numbers show that administered vaccine doses have declined 63% for all children in the city. And for children who are older than 2 years old, doses have dropped, listen to this, an overall 91%. It is staggering. Joining us now is pediatrician Dr. Ellen Renna from Pro Health Generation Pediatrics to talk about this. Good morning, doctor. Can you tell us what exactly you've been seeing in regards to these high vaccine drops?
Well, those numbers are really staggering and a little surprising, actually, because most pediatricians have really made an effort to keep in connection with our patients, and we're keeping the vaccine rate as up as we possibly can by bringing the patients in safely. And the problem is, with this steady drop of vaccines, we're going to start to see the vaccine preventable diseases start to increase. So we really have to move and get the vaccine rate up and do it as safely as possible.
Yeah, I want to talk to you about that because I think a lot of parents, would like to keep their kids home. They don't want to expose them to getting anything by taking them out to a doctor's office where there could be kids who are sick there, right? So that's why they stay home. But could this create some many, situations when it comes to those preventable problems?
Well, Betty, you bring up two good points. The first is the offices, the doctors really, our first goal is to take care of children. So we provide an incredibly safe environment where there's no chance of anyone getting sick from coming to our office. Or any pediatric office. We're very cognizant of there's no more waiting rooms. People are waiting in their cars now. So we call them in right when the room is ready and they can come right in. And there's no overlap between patients. Every room is cleaned in between patients, so that's very, very important. And also there's safe distancing for my staff as well. So my staff is covered with PPE, the personal protective equipment, and the strict hand washing rules, and the parents have to wear masks. But if they don't start getting the vaccine rate up,
what about those mini epidemics that could happen because people aren't bringing their kids in?
Right. Well, we're going to see a resurgence of measles. What happened a year or so ago when the vaccine rate dropped? We saw measles come back. We're going to start seeing meningitis, which is really devastating, Haemophilus influenza meningitis or strep pneumonia meningitis. So the kids have to come back in, and it should be very easy to do. We can, one visit or two visits, we'll be able to catch them up with their vaccines pretty quickly. So they have to get back into the office.
Why is the percentage so high, though, doctor? Let me ask you about this. We got a little bit of a delay, so it's sounding a little off, but why is the percentage so high for children 2 and older? 91% have not gotten their vaccines. Is it because they don't have as many vaccines as the younger kids?
They definitely don't have as many vaccines, number one, and number two, there is a little bit more of a leeway. So because you get the first set of vaccines when you're under 2, so you're getting multiple vaccines a month apart, boom, 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 boom. And over 2, you have your rates of visits drop down tremendously. You only see the patient every 6 months or a year. So patients figuring waiting 2 or 3 months extra is not going to be a big deal. So they'll hold off. And actually, that was not a bad idea when at the peak of the epidemic, waiting a few weeks was not a problem. But now we have to get moving back into the office and getting our vaccine rates up.
Yeah, it is imperative because, like you say, we don't want to see those mini epidemics because that could cause yet another problem on top of what we're already dealing with. Doctor, thank you so much for your time today. We appreciate it, and hopefully this will help parents feel a little more ease at getting those vaccines.